You know, we've worked so hard in this province and so many people have made sacrifices like not seeing their loved ones to try to help keep people safe in long-term care homes. But we also know that there are still outbreaks and the numbers are still going up. So there are still plenty of concerns out there. And now, to add to that, there are concerns about the delays in COVID-19 testing. Well, to talk more about what is going on, joining us now is Terry Lake, the CEO of the BC Care Providers Association. Terry, thanks for being back with us.
Good morning, Simi, and thanks for having me on to talk about something that is a concern for us. Sure.
What is going on? What kind of delays are we talking about here?
Well, there's not just delays, but there's a bit of an inconsistency that we see happening in long-term care outbreaks, in that when there is a positive case identified, in some cases, all the staff and residents are tested, and in other cases, they're not. And so I think there's a level of confusion out there, and it seems to me that we all recognize that long-term care homes are the epicenter of the worst effects of COVID-19, and we should be concentrating our testing efforts in this area so that we can ensure the residents are safe, that we can ensure staff are safe, and that we can open up opportunities for people to reconnect with their loved ones that have largely been separated from them for close to 8 months.
So do you think we should kind of re-emphasize where the testing is happening to kind of make this a priority?
Absolutely. I know there are some concerns in terms of the supply chain of testing materials. But I think if we were to really concentrate our efforts where we have the most vulnerable people, and I say vulnerable not just from COVID-19, but vulnerable to social isolation. We've got people who are living the last part of their lives unable, in many cases, to see members of their family. And, that's just heartbreaking. We've all heard the stories. We've heard families in tears being disconnected from their loved ones in care. So I really think all governments across Canada should be focusing their efforts on this problem, and we should see a more rigorous testing protocol in long-term care homes.
Right, because I know we were ramping up testing, right, to anticipate for flu season, and certainly we're testing more people now, but do you think there still is a lot of room for improvement?
Absolutely, and as we have the rapid tests come on stream, I think we should be looking at long-term care homes as the location to really use those rapid tests to ensure that if you're going in to visit your loved one, if you're going into work in a long-term care home, that you have access to those rapid tests. So we absolutely know that we're keeping those residents and those staff safe. We've heard that these rapid tests will be used in rural and remote communities where they don't have the laboratory facilities for the current existing tests. But I also think that there's a good argument to be made that these should be used in long-term care homes as well.
How close are we to that? And I know that in Alberta, they've actually said they're now no longer going to test asymptomatic people who've had no contact with somebody who has COVID-19 because they also have to refocus their testing.
Yeah, it is a concern for sure, and I don't think anyone really understands why this is happening. I mean, we've been dealing with COVID-19 for 8 months. The fact that we don't have a good supply chain and a good protocol and distribution of tests which would keep people safe, I think is one of the weaknesses of the COVID-19 response. And I would say that here in British Columbia, we've had a very good response generally compared to other jurisdictions across Canada. But I still think the testing protocol is the weak link in our response here in BC.
So have you talked to the provincial government about this? I know it's tough because there's the election campaign going on, but any progress on this?
Well, we have. We have discussions with the Ministry of Health every week. I have discussions with the Seniors Advocate at least once a week. So we have brought up this concern, and I know that the Seniors Advocate is thinking about this as well. And we're looking forward to her survey of families and residents of long-term care and assisted living, which will be coming out relatively soon, because people are feeling that they are separated from their loved ones, and I think this would be a good tool to provide confidence in the people who work in long-term care, that they're not going to be subjected to the virus coming in, and certainly confidence to families that they're not putting their loved ones in danger when they provide those visits is so critical for quality of life.
Now, I can understand for visitors how this would be great, but how do you make it work then, Terry, for people who work in long-term care homes? Like, how often would you test them to make sure that they still don't have the virus?
Well, in a society where we can test NHL hockey players twice a day, it seems to me we should be able to test people looking after our loved ones in care at least once a week or even more often. So I think it's just the priorities. It just doesn't seem to make sense to me.
No, that's a great point. You're right. So when we want to throw our efforts at something, we are able to do it. Absolutely.
I understand. The NHL and these sports teams have lots of money to throw around, but it shows that it is possible to do. And so, if we care about our seniors in care, I think they're worth the investment.
So is that something you're hoping that once we get this election done, that it can be more of a priority maybe in the next couple of months?
I hope so. And, I know that the people at the ministry, I know the people in public health, I know the people in the seniors advocate office are all concerned about people in care. I just think we need a greater discussion about tools we can use to keep them safe and to reconnect families.
I think you made some great points. Terry, thank you.
Thanks, Simi.
It's Terry Lake, CEO of the BC Care Providers Association. That was an excellent point that he made, that if we're going to work on rapid testing, if we are getting to that point where testing becomes more and more common, then he says that we should be emphasizing it in our long-term care homes so that you can go and visit a loved one there using rapid tests, that we can test the employees more frequently so that we can keep COVID-19 out of those care homes. And yes, great point that if the NHL can test players twice a day, if the NBA can do that, then why can't we do it for our long-term care homes? If you want to weigh in, Simi at cknw.com. I think it's only fair, given how much people have sacrificed not being able to spend time with loved ones, that we focus our efforts on getting that system up and running for our long-term care homes. You can also call our buzzline 604-331-2899.